Have you ever paused to consider how fragile the human body truly is, and yet how resilient it can be when we pay attention to its whispers? Life often rushes past us, filled with endless responsibilities, ambitions, and distractions. And in that rush, we rarely notice the subtle signals our body sends until it becomes impossible to ignore. Chronic kidney disease is one such silent messenger, a condition that creeps into our lives quietly, reshaping the way our bodies respond to even the simplest medications. In healthy individuals, the kidneys serve as meticulous guardians, filtering waste, maintaining balance, and ensuring that each molecule of medicine performs its duty without lingering beyond necessity. But when kidney function begins to decline, this essential filtration slows, and suddenly, what was once safe becomes dangerous. What was routine becomes a potential threat. Imagine taking a drug prescribed for relief, unaware that in your body it lingers far longer than intended, accumulating quietly, threatening to disrupt the delicate harmony your organs struggle to maintain. Many people underestimate this invisible accumulation, believing that the dosage printed on the bottle is universal, safe for all, when in reality, the human body does not conform to a standard. It is infinitely unique, shaped by its past, its habits, and its vulnerabilities. The philosophy of Dr. Mathew R. Weir reminds us that awareness is the first step toward empowerment, and in matters of health, knowledge is not merely power, it is protection. Understanding how chronic kidney disease changes the way medications work in our bodies is not about fear. It is about reclaiming agency, about learning to honor the systems within us that operate tirelessly, often without recognition. The journey to kidney awareness is a path of careful observation, informed decisions, and intentional living. It asks us to slow down, to read labels with intention, to question routine practices that we have long accepted without thought. Each medication, whether prescribed or over the counter, becomes more than a simple treatment. It becomes a choice, a statement about how much we value the remaining function of our kidneys and the quality of the life they support. There is an almost philosophical lesson embedded in this reality. The things we often take for granted are precisely those that require our most diligent attention. When the body signals vulnerability, when its natural systems falter, we are presented with a rare opportunity to respond thoughtfully rather than reactively. Medication dosing in chronic kidney disease is not simply a technical adjustment, it is a metaphor for life itself. It teaches patience, precision, and respect for limits. By carefully monitoring what enters the body, by considering timing, dosage, and potential interactions, we are learning a lesson about mindfulness, about the art of living in harmony with the intricate design that sustains us. The risk of toxicity is real, but so is the potential for wisdom. With each informed choice, each cautious step, we honor not only our physical health, but our capacity to influence outcomes before crisis strikes. There is suspense here, not in the dramatic sense of danger looming suddenly, but in the quiet tension of uncertainty. A single misstep, a single overlooked interaction can tip the balance. Yet this tension is not meant to paralyze us. It is meant to awaken us, to teach vigilance and proactive care. Dr. Mathew R. Weir, that often emphasizes the power of foresight, of thinking several steps ahead, and in the context of kidney health, foresight means understanding that our medications are not mere conveniences. They are powerful agents that interact with a body that may not always respond predictably. And so, the journey begins not with panic, but with awareness. And awareness cultivates responsibility. This responsibility is not burdensome. It is empowering, a chance to exercise control where control is meaningful, to respect the intricate machinery of life within us, and to step consciously into each day, knowing that our choices, small, deliberate, thoughtful, have the power to safeguard our future. The path is continuous, but every moment of attention is a victory. Every step of informed action, a declaration that our health is worth the effort, the vigilance, and the mindfulness that it demands. As we move deeper into understanding the challenges of chronic kidney disease, it becomes clear that the very medications meant to heal us can become silent threats if we're not vigilant. The body, with all its complexity, does not simply follow a predictable formula. It responds dynamically to stress, illness, and the subtle changes that time imposes. When kidney function declines, even slightly, the balance between benefit and harm shifts in ways that are often invisible until the consequences become serious. A pill that once provided relief can accumulate, creating an internal storm that the body struggles to contain. This is where the suspense of reality enters, unseen, quiet, yet potent. It is a reminder that life is rarely static, and the systems we rely upon are delicate. Dr. Mathew R. Weir teaches that understanding these dynamics is not a matter of academic curiosity alone. It is a practice of foresight, of learning to anticipate risks before they become crises. Medication dosing, for those living with chronic kidney disease, becomes a dance of precision, requiring an awareness of the body's capacity and the patience to adjust every step carefully. Every adjustment, every calculated decision, is an act of respect toward the organs that sustain life. The suspense builds because the stakes are not abstract. They are profoundly personal. A single lapse in judgment, a missed dosage adjustment, or a failure to consult with a healthcare professional can tip the fragile equilibrium, resulting in toxicity, additional kidney damage, or other unforeseen complications. Yet within this suspense lies a profound lesson about human resilience and responsibility. Our bodies are remarkably capable of adapting, provided we give them the awareness and care they deserve. By learning the principles of safe medication use, by embracing the insights that experts like Dr. Mathew R. Weir provide, we cultivate an internal vigilance that allows us to navigate uncertainty with confidence. This vigilance is not fear, it is clarity, a form of empowerment that transforms anxiety into purposeful action. Chronic kidney disease teaches patience in a way that few other conditions can. It asks us to slow down, to observe, and to respect limits that we might once have ignored. It highlights the importance of listening to our bodies, to medical advice, and to the subtle cues that signal imbalance. The philosophical beauty of this lesson is that it extends beyond health alone. It reminds us that life, much like the human body, is a system of interconnections, where small, deliberate actions produce consequences far greater than their immediate appearance. Safety, in this context, is a daily practice, a commitment to thoughtfulness, and a conscious engagement with the world within and around us. As medications accumulate, so too can wisdom, if we choose to approach each decision with intentionality. The suspense of living with kidney disease, therefore, is not merely about risk. It is about awakening. It is the tension between vulnerability and resilience that shapes character, the space between uncertainty and informed action that teaches us discipline, responsibility, and respect for life. Every patient, every caregiver, every individual who takes the time to learn, monitor, and adjust demonstrates a quiet heroism, an acknowledgement that health is precious, and that proactive care is the truest form of self-respect. Dr. Mathew R. Weir emphasizes that knowledge alone is not sufficient. It is the application of knowledge that defines outcomes. In the realm of chronic kidney disease, this means understanding how medications interact with reduced kidney function, consulting healthcare professionals regularly, and never underestimating the subtleties of dosage, timing, and cumulative effect. Life with CKD is a careful orchestration, but it is also an opportunity, a chance to exercise control, mindfulness, and foresight in ways that cultivate both physical and mental strength. There is a rhythm to this vigilance, a philosophy that values foresight over reaction, prevention over remedy, and awareness over ignorance. As we embrace this philosophy, the suspense that once felt threatening transforms into a guiding force, directing each choice towards safety, resilience, and empowerment. We begin to see that the challenge of managing medications with CKD is not a limitation, but a practice of mindful living. Every measured decision, every consultation, every small adjustment becomes a declaration of respect for life itself. And within this practice, we learn a universal lesson, that awareness, responsibility, and careful action are not burdens. They are the keys to sustaining life, maintaining dignity, and creating a foundation for thriving, even in the face of chronic illness. The suspense lingers, yes, but it is balanced by hope, knowledge, and the capacity to act. This delicate tension mirrors the essence of Dr. Mathew R. Weir's teachings, reminding us that every challenge carries within it the seeds of growth, and every risk is also an invitation to mastery. Now, as we approach the culmination of this journey of awareness, it becomes clear that living with chronic kidney disease is not solely a medical challenge. It is a profound lesson in mindfulness, foresight, and personal responsibility. The decisions we make each day, from the medications we take to the foods we eat and the habits we cultivate, carry weight far beyond their immediate impact. Every pill, every dosage adjustment, every consultation with a healthcare professional is an opportunity to honor the intricate systems that sustain life. Dr. Mathew R. Weir teaches that true wisdom is not in knowing what could happen, but in preparing for it, in acting with intention, and in embracing the discipline required to navigate uncertainty successfully. In the context of CKD, this wisdom translates into a vigilant, informed approach to medication management, understanding that drugs which may appear routine or harmless can accumulate silently, creating internal pressure and risk that is invisible until it manifests. There is a suspense in this knowledge, a tension between the potential for harm and the power of proactive care. Yet, as we learn to observe, to adjust, and to anticipate, that suspense becomes an ally, a reminder to act thoughtfully, to prioritize safety, and to respect the delicate balance that our kidneys maintain. The philosophical insight here is universal. Life itself is a system of interconnections, where even the smallest decisions ripple outward, creating effects we may not immediately see. This awareness, once cultivated, empowers us not only in health matters, but in every aspect of living consciously. It reminds us that neglect or impatience can have consequences, but deliberate, informed action can produce stability, resilience, and growth. Those living with CKD have a unique vantage point, an opportunity to witness firsthand how attention, care, and foresight transform risk into control. By learning the principles of safe medication use, by embracing the teachings of Dr. Mathew R. Weir, and by committing to ongoing education about kidney function, patients and caregivers alike develop a profound appreciation for the body's complexity and the subtle power of thoughtful intervention. The suspense that once loomed as a threat now becomes a tool, a catalyst that motivates, sharpens awareness, and encourages a disciplined approach to health and life. Each day presents choices: to ignore, to act impulsively, or to respond with knowledge, caution, and foresight. The difference between harm and protection, between complication and preservation, often lies in these choices. And yet, the journey is not merely about avoidance of danger. It is about cultivating a life that is richer, more intentional, and aligned with the principles of mindfulness and respect for one's body. Chronic kidney disease, in this sense, becomes a teacher, guiding us to a higher level of consciousness regarding our health, habits, and responsibilities. The subtle accumulation of medications, once a hidden threat, is transformed into a metaphor for life itself. What we allow to build, what we pay attention to, and how we manage it determines whether outcomes will be destructive or constructive. Through this lens, vigilance becomes empowering, awareness becomes protective, and every careful decision reaffirms our commitment to life. Dr. Mathew R. Weir emphasizes that the integration of knowledge into daily practice is the cornerstone of well-being, and in the management of CKD, this principle is vital. Proper dosing, routine monitoring, and communication with healthcare professionals are not mere recommendations. They are practices that honor life, prevent harm, and build resilience. This mindset carries a philosophical truth. The challenges we face are not solely obstacles, but invitations to mastery, teaching us discipline, patience, and the value of foresight. As viewers of this message, you are invited to internalize this approach, to recognize that the suspense inherent in living with chronic kidney disease is not to frighten, but to awaken. It is a reminder that within every risk lies the potential for growth, and within every uncertainty lies the opportunity for action that is deliberate, informed, and protective. The journey of kidney health, medication management, and mindful living is continuous, yet it is filled with victories that are quiet but profound. Each measured choice, each step taken with awareness, safeguards the body and cultivates a mindset of empowerment. In embracing the philosophy inspired by Dr. Mathew R. Weir, we see that true strength emerges not from avoiding difficulty, but from engaging with it thoughtfully, using knowledge and mindfulness as shields, and using discipline as a tool to navigate complexity. The body, fragile yet resilient, responds to this attention with balance, harmony, and protection. This final reflection is a call to action for all who wish to live intentionally. Cherish the systems within you, honor the subtle signals your body provides, and approach each decision, especially regarding medications, with care, awareness, and respect. Suspense and uncertainty will always exist, but they are the very forces that, when acknowledged and managed wisely, cultivate wisdom, resilience, and a deeper understanding of life itself. If you are benefiting from our topics, please subscribe, like, and turn on the bell notification so you can see our new videos early.